Welcome to the Canadian Beef Cattle Podcast, presented by the Beef Cattle Research Council, the most popular content from beefresearch.ca, available on the go. Before we get into this week's episode, a quick message from the BCRC. Often a hidden hazard in beef cattle diets, mycotoxins are a group of harmful toxins produced by certain types of fungi, including mold. They can create a variety of problems for beef cattle, including impaired health and reduced productivity. The risk of mycotoxins being present at high concentrations in cattle feed can fluctuate substantially in any given year based on the environmental conditions present during growth, harvest, and storage. These conditions can also determine the potential type of mycotoxin contamination. For example, fusarium production favors warm, moist conditions during the flowering stage. In contrast, ergot prefers cool, moist conditions during this growth stage. Learn more about detecting mycotoxins and how to protect your cattle by clicking the links in the show notes. This episode features the BCRC Science Director, Dr. Reynold Bergen.
Hi there, I'm Reynold. This Research on the Record article originally appeared in the October 2024 issue of Canadian Cattleman magazine, and we've reposted it on the beefresearch.ca site with the publisher's permission. So today we're going to talk about why are you so lame? Cattle get lame for a lot of reasons, including injury and poor conformation and grain overload and mycotoxins like ergot and bacterial infections. And different types of lameness need to be treated differently, and antibiotics are only going to help if there's a bacterial infection involved. Now, this is important because lameness is the second leading reason behind bovine respiratory disease that feedlot cattle get pulled and given antibiotics. And of course, lame cattle eat less, so they grow more slowly and less efficiently, and they might get shipped early, and they often don't grade as well. And all of those things add up to significant economic costs. And when cattle get lame late in the feeding period, then pre-slaughter withdrawal times limit the number of antibiotic treatment options that you can safely use. So a team of researchers led by Agriculture and Agri-Food Canada's Karen Schwarzkopf-Genswein recently published a review of large-scale studies of foot-related lameness in feedlot cattle. And there's a link to the paper in the online version of the article. So what did they do? Well, these researchers reviewed studies of infectious foot-related lameness in feedlot cattle. So that means they weren't looking at studies related to chronic arthritis that are caused by things like mycoplasma or Histophilus, because those are more about the joints than specifically about the feet. But the studies they looked at included several multi-year studies collected in Canadian feedlots with treatment records on between 10,000 to over 1 million cattle. And when you've got data sets that large, then researchers can start to find really important, hard-to-find details and disease patterns. So what did they learn from this? Well, one thing is that not all types of foot-related lameness are equally common. And foot rot is the most common cause of infectious foot-related lameness in feedlots, and that's true of cow-calf operations as well. Foot rot can occur at any point in the feeding period. It often shows up on a hind limb, and it causes swelling between the claws of the hoof that may extend into the lower leg. Now, I understand this is kind of a tall order, but if the front of the foot is clean, then a foot rot lesion often looks dark, and it's surrounded by jagged edges where the skin is sort of sloughing off a bit. Now, early detection and treatment are really key to preventing a worse infection from developing, and foot rot usually responds to just about any long-acting antibiotic. And so if the initial treatment doesn't fix the lameness, then it's probably not foot rot. Now, there's several different bacteria that appear to be involved, which might be why available foot rot vaccines aren't effective. But there's lots of work underway to develop better ones. And foot rot is most common when pen conditions are poor, and so good drainage and a good bedding mound and bedding help to reduce the risk. The second main hoof-related infection was digital dermatitis. And now that's also called DD or strawberry foot rot or hairy heel wart. So it's got a few different names, and it's also much less common than foot rot is in feedlot cattle. Now, DD is more commonly associated with dairy cattle than with beef cattle. It's rarely diagnosed in cow-calf operations, but it's becoming more common in feedlot cattle. It doesn't usually show up until cattle have been on feed for 3 months or more, and sometimes it occurs at the same time as foot rot. Now, cattle that have DD may not be lame, and the affected foot might not be swollen, and so those cattle might be harder to find in the pen. And that might also explain why it isn't often seen or diagnosed in cow-calf operations, just because they're not necessarily visibly lame. Now, DD starts out as a circular or oval strawberry red lesion where the skin and the heel bulbs meet at the back and bottom of the foot. In more advanced or chronic lesions, the infected skin can get rough and scaly and develop really long hair-like projections. Now, DD generally responds to topical antibiotics such as tetracycline that are applied to the skin. So that means applied like an ointment, not an injection. And copper sulfate foot baths are sometimes used. They're less effective for treatment, especially once they've been contaminated by dirty hooves, which is almost immediately. Properly disposing of used copper sulfate once it's gotten dirty is also a problem from an environmental safety perspective. Now, DD is caused by multiple bacteria, but different bacteria than ones that cause foot rot, so there's no vaccine for this one either, yet. And again, clean, well-drained, well-bedded pen conditions help to reduce the risk of DD, just like foot rot. And these digital dermatitis bacteria can survive in the soil for a long time to infect new cattle. And so that's a problem because once a feedlot's contaminated, it's probably become just a fact of life from here on out. Now, the third one they looked at was toe tip necrosis. This is one that nearly always occurs in the first days to weeks after the cattle arrive at the feedlot. It always shows up in the hind limbs, either one or both hind limbs at the same time. There is no swelling, which makes it different than foot rot and trauma. It's believed to happen when the sole of a hind foot has been scraped really thin on rough concrete floors in the auction barn or on a handling area, so rough, rasped really fine. And then when that sole is worn down, it can develop a tiny little crack where the sole meets the tip of the toe of the hoof, and that allows debris and bacteria to enter into that crack, sort of like when you get a sliver under your fingernail, and then that can turn into an infection. Now, toe tip necrosis is more common in excitable cattle and in groups of cattle that are handled aggressively. Early in the disease, affected cattle tend to be slightly lame and take really short steps, but if they're left untreated, those animals can end up becoming quite lame. So diagnosis and treatment of this one involve nipping the tip of the toe to confirm the diagnosis, then allowing it to drain like an abscess and giving it a long-acting antibiotic. The best ways to prevent this are to avoid the temptation to buy wild cattle at a cheap price, to have appropriately and not overly aggressively grooved floors in your handling area, and to manage low-stress cattle handling. So bottom line is that not all lameness is caused by an infection, so not all lame cattle need antibiotics. Not all lameness is foot rot, so there is no one-size-fits-all treatment. It's a lot easier to make an appropriate treatment decision if you can get a good look at the foot before treating it so that you can be more confident about why it's lame and how it should be treated. So what does this mean to you? Well, low-stress cattle handling and keeping pens clean and dry aren't always easy or cheap things to do, but lameness isn't always a cheap or easy thing to deal with either. Now, if you're interested in learning more about lameness, And if you like podcasts, then John Campbell's Beef Cattle Health and Nutrition podcast has some really good episodes on foot rot and digital dermatitis.
Thank you for listening to this week's episode. You can find all relevant links and information at beefresearch.ca or in the show notes. The Beef Cattle Research Council is funded by the Canadian Beef Cattle Checkoff and strives for excellence in the production of Canadian beef, cattle, and forage through research, innovation, and extension. Tune in every Tuesday as the Canadian Beef Cattle Podcast delivers straightforward insights, expert information, and a wealth of practical knowledge for Canadian beef producers. Subscribe now.